Thank you very much to the organizing committee, and thank you very much to Mario. The next few minutes I will talk about the topic over here. For some reason I have a fascination for the shoulder joint and for the complex story of overuse injuries in volleyball players. Maybe because I'm female, females are somehow complex too, but anyways. Volleyball players expose their shoulder joint to extremely end-of-range positions. So it's not surprisingly that overuse-related shoulder problems with symptoms such as pain, stiffness, or looseness are a common problem in this population. These problems are associated with sport-specific adaptations in range of motion, strength, and scapular control. In order to successfully prevent overuse injuries, one important step is to identify its etiology and mechanisms. Therefore, we need more clearness about how much adaptation is normal. And we also need data for each overhead sport population separately. In addition, attention needs to not only focus on the shoulder joint alone, but also the core. Based on these aspects, we were interested in evaluating adaptations in range of motion, strength, and scapular control in volleyball players with and without overuse injuries, and in analyzing group differences of these adaptation values at the shoulder joint and the core. And third, we were interested in understanding how core stability is related to these adaptations. Based on this background, we performed a cross-sectional study with including healthy elite female volleyball players. All players completed a comprehensive questionnaire to assess history and current shoulder problems. And all players went through standardized field tests such as passive shoulder range of motion and isometric strength, both measured in internal and external rotation, as well as scapular control and core endurance. The results showed that out of 60 participating players, more than 50% reported current shoulder problems. 10 players reported having experienced a past shoulder injury, of which 3 underwent surgery and 7 were treated conservatively prior to the study. If we look at the sport-specific adaptations, we found in all players on the dominant shoulder a glenohumeral internal rotation deficit and almost the same amount of an external rotation gain. The dominant shoulder also showed an internal rotation strength gain and, as a consequence, a lower strength ratio of the external to the internal rotators. And we also found scapular dyskinesis was more prevalent on the dominant shoulder. And these results are consistent with previous findings in other overhead athletes. But important to mention is that all of these side differences are quite small, and the effect size was small as well. So the question arises about the clinical relevance of these results. The between-group analysis showed no significant differences between symptomatic and non-symptomatic players, neither for shoulder nor for the core results. But if we excluded players with a previous history of shoulder surgery or pathology, since we assumed these players would bias the data, this new between-group analysis showed that symptomatic players had less internal rotation strength gain and a tendency of external rotation strength deficit. This result was partly consistent with previous study findings and was above the standard error of measurement and minimal detectable change with a medium effect size. So it can therefore assumed to be clinically relevant. And our third analysis showed that the external rotation strength deficit at the shoulder correlated with a low core endurance. To put the results in a more comprehensive context, I would like to discuss some methodological aspects. First, the two groups differed significantly based on some demographic and sport-specific aspects. Since there is conflicting literature about concerning these characteristics, we did not control for them. Second, we performed the range of motion and strength measurements in the least pain-provoking shoulder joint position. But from a clinically point of view, these positions are not sport-specific. Third, core stability is defined as a complex interaction of different components and not only the core endurance. So we have only information about one single component. And lastly, since shoulder pathologies are common in high-level volleyball players, our sample is representative for this cohort. Nevertheless, inclusion of these players can potentially bias the data. As a conclusion, I would like to highlight two perspectives. From the research perspective, we can summarize that symptomatic players are weaker and an external rotation weakness at the shoulder correlates with a low core endurance. But due to the study design, we are talking about associations rather than a true cause and effect relationship. Consequently, we need further high-quality studies with a prospective design to obtain reliable information about risk factors causing overuse-related shoulder problems. From a clinician's point of view, in my opinion, it's most important to bring the best available research combined with experts' opinion into the daily work. So the assumption preserving muscle balance in managing overuse-related shoulder problems has its legitimation as long as further information is lacking. But also a regular monitoring of overuse injuries and the regular monitoring of shoulder and core function should be standard for physiotherapists working with elite overhead athletes. Then you have the chance to detect overuse injuries and abnormalities to a very early stage. Thank you very much.